of our institutions, first of all. So, as everybody here is aware, ECOWAS has 15 member states. We are working with the ECOWAS Commission, which is our political partner, and then our implementing partner is the West Africa Health Organization, and specifically the Regional Center for Surveillance and Disease Control. And we also have a number of different partners at national level, so we work with 6 different member states within ECOWAS as well. And we call those our focus countries. And our focus countries where we work are Guinea, which obviously is in the news at the moment because of the Ebola outbreak there. Also Sierra Leone and Liberia. And then lastly, Togo. But on top of those 4 focus countries, we also work here in Nigeria with the Nigeria Center for Disease Control, and in Ghana with the Ghana Health Service. And in those 2 countries, we're supporting the implementation of a system called SORMAS, which is a digital outbreak response and management system. The whole ethos of our program, our ultimate goal, is to enhance the ability of the ECOWAS Commission and WAHO to perform better in epidemic control, and particularly recognizing the cross-border nature of pandemics. And essentially behind that is a need to strengthen the regional network for outbreak preparedness and response. And a couple of words on history here, because I think since the Ebola outbreak of 2014-2016, the whole approach to regional preparedness in ECOWAS has changed. At country level, we've seen a lot more emphasis on disease surveillance and control, and then obviously RCSDC was established to deliver that function on behalf of the centre. And essentially what we're doing here is supporting the African Union's own development of 5 regional centres of surveillance and disease control, and so the RCSD is one of those 5 centres. But within the region, the establishment of the national coordinating institutions is the first step, and a very major step in terms of actually developing that regional network within the southeast. Within the ECOWAS region. I've mentioned already some of our partners at the central level, the West Africa Health Organization, the RCSDC, but also the Regional Animal Health Center, which is based in Bamako, but which is also part of the One Health approach to disease surveillance and response. Then at national level, we're working with the countries I just mentioned, but specifically with the Agence Nationale de Sécurité Sanitaire in Guinea, but also with the National Public Health Institute of Liberia, the Institut National de Coordination de Togo, and then the National Public Health Agency and Ministry of Health in Sierra Leone. Very briefly looking at our main areas of activity, and I mentioned the idea of building the network. So a network needs good communication and coordination, and that's one of the primary activities that we've been supporting in the region. So improving the coordination between the ECOWAS institution, the specialized agencies, the NCIs, and all our other partners in the field. Communicating risk, so the messages really can be disseminated from the center here in Abuja all the way down to the front line. So improving that overall risk communication, because the quicker we can communicate risks on infectious diseases, the quicker we can act. So that's an essential part of our role here. Then building human resource capacity to respond is also key. And lastly, the digitalization of outbreak management and response. Again, it contributes to this overall speed with which a response can be given. The better the data, the better the response, basically. I won't really go into much more detail, except because etc. Just mention maybe a little bit about the activities that the project has been supporting in COVID times. And obviously the reason why we're here today is to hand over consignment of goods. This consignment behind us is a range of different personal protective equipment and oxygen concentrators and various other paraphernalia for the oxygen equipment. And obviously, as everybody here knows, oxygen therapy is essential for people with respiratory illnesses, so I think this is a very important contribution. And protection of healthcare workers and prevention of hospital-acquired infections of COVID is obviously very important as well. So this will really contribute to the response of COVID, also other outbreaks up and coming, like Ebola, for example. But what we also did was work with WHO offices in the countries, so there was a direct support to the response in individual member states in our focus countries and also in Nigeria. And additionally, money from the European Union and from BMZ went to support the rollout of the disease surveillance system, SORMAS, that I mentioned at the beginning. I'm coming to an end now. I'd just like to say that as I come to an end, also the first phase of RPPP, our regional project, comes to an end. But we're pleased to say that from July 2021, the program will continue, and we'll have 3 more years of implementation to support RCSDC, to support the member states, and particularly our focus countries. So with that, I'd like to hand over to my country director, and I'm not sure if Aisha wants to do that or whether I'll do it myself. But
I'm very pleased to be here with you this morning on behalf of the European Union and Team Europe. The European Union has launched its Team Europe package to support partner countries in the fight against the coronavirus pandemic and its consequences under the motto "Stronger Together Against COVID-19" to support all partner countries. Team Europe approach is about the European member states joining forces and pulling together with the European Union institutions their resources, as well as financial institutions such as the European Investment Bank. Team Europe has mobilized 38.5 billion euros in response to the COVID-19 outbreak worldwide, of which 8 billion euros in Africa. The EU support to the West Africa region amounted to more than 1 billion euro, delivered notably through a quick reorientation of resources and support to the health systems and measures to mitigate the economic and social impact of COVID-19. The challenge has been to mobilize funds quickly and without prejudice to respond to other ongoing crises linked to displacement, conflict and food access. The European Union is also an important and long-standing partner of ECOWAS in many sectors. And regarding health in particular, the European Union has been actively supporting pandemic prevention and control in the ECOWAS region via its action support to the Regional Center to Surveillance and Disease Control, which is the regional hub for coordinating preparedness and response to public health events emergencies in a project co-financed by the government of Germany. Through the project that is gathering us today alone, the Regional Program Support to Pandemic Prevention, the European Union has channeled over 10 million euros into the COVID-19 response of ECOWAS and its member states. Technical assistance is a key part of building capacity, but sometimes materials and equipment are also needed. This initiative is designed to meet that need. Part of a rolling program of procurements to support the ongoing response to COVID-19 and strengthen the health systems in the region, the consignments handed over today contain critical personal protective equipment which will be used by the healthcare workers involved in response activities and patient care. The second part of the delivery includes urgently needed intensive care unit equipment, which will be needed for properly setting up ventilators for intensive care patients. We hope that these donations will go a long way in supporting ECOWAS member states' efforts at controlling and containing further spread of the COVID-19 virus within communities, as well as help in revitalization of the national healthcare systems. We meanwhile deeply appreciate and applaud the efforts of the healthcare workers in facilities across the 15 ECOWAS member states, who will be direct beneficiaries of this donation and who have collectively made huge sacrifices so far to stop the scourge of COVID-19 in the region. In Nigeria too, the EU has been playing a key role in reaction to the COVID-19 crisis as well. We managed to quickly allocate 50 million euros to the One UN Basket Fund in response to COVID-19, launched to complement ongoing government efforts. The fund has supported rapid procurement of disease commodity packages for surveillance, prevention, and control risk communication and community engagement strategies, while strengthening states' capacity in the detection, surveillance, and optimum adherence to infection prevention and control measures. As we speak, Nigeria is now getting ready to embark in the COVID-19 vaccination campaign. The country has expressed interest in the COVAX facility, and I am pleased to inform you, for those of you who have not seen it yet, that on February 19, the European Union has doubled its contribution to the COVAX facility to 1 billion euros, leading efforts to secure fair and equitable access to effective COVID-19 vaccines in low and middle-income countries. As Nigeria, I think, is about to receive the first batch of doses from vaccination doses from COVAX, we hope to witness this arrival together with you, Minister, soon. As we navigate through this pandemic, Team Europe reiterates its commitment to its close collaboration with its partners in the response and control of COVID-19, as well as its continued support for the enhancement of regional prevention and preparedness in the years to come. As I close, our thoughts and prayers are with the families, friends, and communities impacted by this pandemic. We, however, remain confident that our global collective will enable us to emerge stronger together from this tragedy. Thank you.
Thank you very much.
And my privilege to join this ceremony of the official handover of COVID-19 response materials donated by the European Union and the German Ministry of Cooperation and Development with the technical and logistical assistance of German Society for International Cooperation. Today, medical supplies procured in support of the Regional Emergency Fund will be transferred to the West African Health Organization for the benefit of ECOWAS member states. I applaud all the donors and facilitators for this special generosity to the ECOWAS region during these very challenging times of the COVID-19 pandemic. As you all know, we exited the first wave believing that we might be out of the woods. And there were those who wanted to congratulate us, and we said, please hold it. We do not know where we are going. Lo and behold, the second wave came in, which we are all battling. And I want to particularly commend our friends and partners and donors in Europe who are also battling the second wave, and in some cases had to do very badly, deal with very serious challenges. And nevertheless, despite that, found the time and the resources to also give attention to Africa, and in particular to West Africa. This is not the first time the organization is showing such generosity to our region. Therefore, this gesture is worthy of commendation. We recall that Europe was a significant donor to the One Basket Fund of the UN system. We have enjoyed the cooperation and collaboration of multilateral organizations, as well as the bilateral technical support, which has helped us so much to get to where we are. The West African Health Organization has been working very hard under the leadership of Professor Stanley Okolo, my very good friend and partner in this battle, and to tackle the considerable task of coordinating the entire process of bringing all parties together in ensuring timely delivery of medical supplies to member states. As you all know, the President of the Republic, President Muhammadu Buhari, was named the COVID-19 champion for the ECOWAS region, and with that came upon me the chairmanship of the Ministerial Coordinating Committee responding to COVID-19. And on that, we have had to take what we call an all-of-ECOWAS response, that no country is left behind, because as the Director General of the World Health Organization has stated many times, no one is safe until all of us are safe. If we are not safe, our neighbors are not safe, and if our neighbors are not safe, we are not safe. So we endorse the all of West Africa approach, and also we say here that the AVAT, that is to say the African Vaccine Acquisition Task Team, set up by the African Union under the chairmanship of the President of South Africa, has taken the same approach on the Africa response, that no Africa country is left behind. And in this respect, I will say that we are in step with the European Union, which is doing about the same thing, providing not only a unified European approach, but also supported by a financial system. And in this case, the African AVAT system, African Vaccine Acquisition Task Team, is supported by the Afrexim Bank, that placed $2 billion on the table and also is receiving donations to ensure that the entire African community of nations marches along successfully to control the COVID-19 pandemic. The ECOWAS region is also working on a regional fund to be able to provide resources to member states who require the resources either for procurement or possibly also for operations. The purpose is that we all want to be safe and wish to be able to be our brothers' keepers and work together towards the same destination. Now, the ECOWAS Ministerial Committee on Health, the champion on whose behalf I'm here today, sends greetings and will ensure that these donated medical supplies will be efficiently, correctly distributed to all intended recipients. We have had a brief on the formula that will be used here for equity and also timely distribution. And we like to again say that this should not be the end of collaboration. We continue to talk to each other, to learn from you. And I must say that we learned a lot from just looking at the news and the responses in Europe. We learned from all the successes and all the steps that we are taking. We also thought we identified some mistakes that were made, from which we also learned of what is happening in America and what happened in Europe, because the advantage of being able to look behind, walk from behind, is watching those who are in front and seeing what they did so that we do not repeat the mistakes. The emphasis in Africa today are fourfold. First is to make sure that routine medical services are maintained and, if possible, even improved upon, because we do not want a situation where the overall generally fragile health system begins to collapse under the weight of COVID-19. And the needs of the healthcare needs, which before now were not really fully satisfied, should not in any way be compromised by too much fear or too much focus on COVID-19. So we'll make it a very serious point of duty of reminding ourselves in the West African sub-region not to allow routine and essential health services to drop or to recede or decline in the face of COVID-19. Secondly, to continue to press infection prevention and control, especially among healthcare workers, because 1 or 2 or 3 healthcare workers who fall sick will mean 1 or 2 or 3 persons less to care for the sick. So therefore, we continue training and retraining of healthcare workers in necessary measures, providing personal protective equipment, for which particularly in your thoughtfulness, you have helped us with replenishment with these supplies we have behind us here, and that we are able to make sure that we do not run short of protective equipment. The third focus we have is on therapeutics. We continue to want to improve on the way we treat those who are infected, and also to make sure that we give advice and protection to the elderly and those who have vulnerable conditions, and to ensure that we are watching the development of therapeutics across the world. We tried everything that has been tried overseas, whether it was chloroquine, hydroxychloroquine, remdesivir, whatever it is. We also participated in and saw the benefits and or lack of benefits therefrom. But everybody has now zeroed in on the pressing need of the day, which at the beginning was thought to be ventilators. We were all short of ventilators and lobbied for ventilators. And I believe that these same friends and partners were very kind in providing us with large numbers of equipment of ventilators, including the US government, which we have in store, but discovered that our needs are actually high flow oxygen supplementation. And we thank you very much for these oxygen concentrators we have here, which will enrich the assets and our inventory to be able to give oxygen supply. Luckily enough, not only to COVID cases, but even post-COVID, to the pneumonia, asthma, and as you know, pneumonia is one of the biggest killers of under 5, and these equipment will come in useful even after COVID-19. Now, the fourth is vaccines. We are on the threshold of receiving vaccines now. Actually, we have waited patiently to receive our vaccines. I believe that most European countries are halfway past their vaccination, at least in the United States. But we are happy to start, and thank you for the generosity, and particularly European generosity of adding some more money. We already got advanced information that the COVAX facility, which was supposed to support 20%, will probably be supporting 27% of the needs of Africa, and the rest of it we are trying to support with the African Vaccine and Resilience Task Team initiative, so that we also aim for herd immunity of 60, if possible 70%. So therefore, we want to continue to work with European countries. There some appeal has been made that Europe can also still donate some of its excess capacities in vaccines, because we understand there are Europeans who have very well beyond their very immediate need on vaccines. The Director General of the World Health Organization has referred to that very often, and we also ask that your governments be sensitized. We hear that France and the United Kingdom have, as a matter of fact, both mentioned that they will cede some of the vaccine options they have to us in Africa here so that we can all fight this disease together. COVID-19 is a threat to mankind. It's not just a threat to one country. The speed with which it has gone around the whole world shows that it's a threat to all of humanity. And therefore, humanity, mankind must fight it together. And for the cooperation we've had from you, I want to especially again, before I sit down, thank the European Union and thank the government of Germany and the GIZ for the effort and for all the
My name is Damien Bishop. Today we're handing over 2 large consignments, one of personal protective equipment and one of intensive care equipment. So I mentioned in my speech, we need the PPE materials to protect healthcare workers when they're doing their jobs, and the intensive care equipment specifically is oxygen concentrators, and oxygen concentrators are very important in dealing with respiratory illnesses. So this is part of the contribution to the ongoing response to COVID across ECOWAS.